This is Dr. Gaurav Deka here. I'm a medical doctor and a transpersonal therapist. In the last episode, we talked about the different cases which helped us identify what an inner child is, how does it survive, and why we need to find it. Now, in many of my trainings, I ask people how much of me and how much of I is I. How much of mine is mine? Because this I of today is not just the I of today. The I of today is also carrying the I of yesterday, 10 years back, 20 years back, elements from my family, elements from my mother, elements from my father, which means family is also important in the development of the child. Now I'll give you a case. This is a case of a little 7-year-old who comes with what we call as ADHD, Attention Deficit Hyperactive Disorder. I beg to differ and I call it the wandering child. The child keeps on wandering, the child has no focus, and the child probably is absent from his body. Now when we look into his family history, we find out that the child's mother's parents, as in the child's maternal grandparents, the grandfather has left the grandmother long time back. However, the child's mother has remained contact with the grandfather. Not only that, but the mother is extremely loyal to the grandfather, because of which the mother's mother, the grandmother, is quite angry with her. And this father, the mother's father, is aloof, he wanders away, he's almost always lost. Now, the mother has great loyalty for her father for some reason, because of which this child slowly grows up to thinking that I don't have my mother's attention. If I become like my grandfather, I will have her attention. And that's how unknowingly, unconsciously, the child replicates the grandfather's behavior. We have a way of healing it. We call it inner child therapy in systemic family therapy, where we work with inner child and family therapy as well. The second case is the case of this 22-year-old boy who comes with extreme amount of shoulder pain. The emotions related to the shoulder pain are he feels really responsible, of course shoulders, and he also feels extremely guilty. Now again, when we look into his family line, we figure out that his father's father and mother, fathers as in paternal grandparents, they had lost 6 children, miscarriages. They had lost 6 children. Only after that the father was born. Clearly the father was under a lot of pressure from the grandparents who protected him, who kept him secure, who did not let him venture out. He was the responsible one. And then the same story repeats in the father's case as well. This 22-year-old boy, before he was born, he already had lost 2 brothers. One was stillborn and the other was an abortion. And because of which the dead is not actually dead. We are all carrying impressions of the dead and the lives of the dead that they did not live. So the burden of all those children is being carried by my client today. Whoever has not lived, someone has to balance it out in the family, either subsequent generation or next generation. In this case, my client was balancing that imbalance of losing those people in that particular generation. And this is what we also call as family therapy. And therefore, I ask this question that how much of I is actually I? Because I may not be living my life, I may be living the life of many other people who are behind me without my own knowledge. And we do this because ultimately at the end of the day, we are loyal to our family. We love our family. And this love is not conscious, it is unconscious. But at the same point of time in family therapy, we try to understand that I can be loyal, I can be in love with my family, I can give them everything, but do I need to carry on with the burden and the trauma that they experienced? Maybe not. Maybe I can choose otherwise once I become aware, because awareness is the doorway. So that is all for today. Signing off from TOI Health and Fitness. Thank you so much.